All right, Christina, thanks so much for doing this. My first question that I have for you is tell the audience a little bit about yourself and how you started in the community.
Yeah, so my journey really kind of started with my undergraduate degree. And I did my dissertation on women's autistic women's experiences of autism. And that's when I became really, really passionate about autism. And for the last 3 years, I've been a therapist and a coach. And in the last year, I've also started doing autism assessments, mainly for children, but for adults as well.
Hmm. I saw a YouTube clip about that once. You were talking about like some type of assessments. I'm just kind of curious as to what that is and sort of how that all works.
Yeah, so the part that I do is mainly the autism diagnosis interview, which is a parent interview, and it really is a lot of questions. So it's about 90 pages of questions. And it really goes in from you're talking about birthing, was there anything that happened there, from being a baby, all the way up into where the individual is now. And it really just paints a picture of the challenges that person has had throughout their whole life. Because what's most important is to determine whether it is autism or perhaps there's something that's happened that's maybe made that person more withdrawn.
Hmm. That's a lot of questions. Yeah, it's a lot, I
Yeah.
guess.
It's a lot of questions, but I guess the more comfortable you get as a practitioner, now I know the interview so well, I don't have to necessarily ask all those questions because I know when a parent is talking, I'm like, oh, okay, they've answered this one already. So usually the interview takes around an hour to 2 hours.
Oh, that's good. So tell me a little bit about some of the modalities that you use in your current practice
So is that for therapy?
for therapy. Yeah.
Yeah. So I've been trained in psychodynamic therapy and cognitive behavioral therapy. But when it comes to being a therapist or a coach for someone with neurodivergency, I mostly kind of base it on sort of like self-compassion, working through the trauma of, living in a world that maybe isn't best suited for someone with autistic and kind of helping them find a way to be compassionate about themselves and kind of find a way that they can truly be themselves, but also kind of mitigate the challenges that they're facing, maybe developing certain social skills or coping mechanisms.
So how does that work? How does the whole thing, how do you sort of make that happen? What in the room you're with a patient that has autism. So what do you do from your perspective to make that happen?
So I get very specific. So, for example, somebody might come with like a broad issue, maybe like challenges within their relationships. And I get really down kind of like into the nitty-gritty of exactly what is happening so that perhaps, for example, an issue that often comes up is like, especially in relationships, maybe one-to-one with their partner, things are going great. But then when they meet their partner's family, that becomes more difficult and they can't quite keep up with expectations. So maybe looking specifically into, well, what environments do they thrive in best? Or, maybe planning what topics of conversations that they could bring up, or maybe making a bit of an escape plan or like some time that they can have some respite. So really just trying to find what's going to work best for them in those specific situations.
Hmm. It's kind of that sort of like getting to meet that family that is kind can be kind of difficult because there are certain family dynamics and they might not approve of certain people, yeah.
Yeah, so a lot of it's to do with I find like sort of helping that person find really like who they are and also how they could show up as themselves in the best way that's also gonna bring them the outcomes that they like, that they want, and can feel really connected as well.
It's sort of this idea of like it's not you, it's me. That's what happens in a lot of relationships. One person might be totally invested, the other person doesn't feel like they fit in.
Yeah, exactly. And I think a lot of the time for autistic people, maybe they do get misunderstood a lot. So maybe people take it that they're not as interested, and maybe there are certain ways that they can show their interest in sort of doing it in a deliberate way, and also finding what those qualities are. Because I found that with the autistic people that I've worked with, there's so many amazing qualities that they have from being autistic, that makes them an amazing partner. They're often like very loyal, very honest, and very committed to their relationships. It's just about kind of working through that communication.
Hmm. So my next question, switching gears, is like, what have you learned in doing this kind of work? What what has doing this work meant like for you, and like, what do you still hope to learn, like to gain new insight or to tr learn something new?
Um, so I found my work incredibly rewarding. I really love seeing, a lot of my clients come to me and they're really hate themselves a lot of the time with the way that they are. And then I love to kind of see that they become a lot more self-compassionate. And I think the number one thing is having them find love for themselves, but also being able to connect with people better as well. I think connection is really what brings people the most fulfillment in life, which is why I found working with autistic individuals so rewarding. Um, and the thing that I'm really passionate about learning about moving forward is I think a lot of the diagnosis criteria with autism could do with some work. What we're finding is that the more and more research that is done, autism is becoming more and more prevalent. It's around 1 in 30 people we suspect have autism. And so I'm really excited to see how the diagnosis criteria is going to improve, especially when it comes to diagnosing women. And also within therapy, I think a lot of the time, traditional therapy approaches um, don't really work for autistic people, because a lot of it is to do with a different understanding of the world, and perhaps talking about emotions can be quite difficult for someone with autism because often that's an area which they find it difficult to feel those emotions or pinpoint those. So I'm excited to see what new approaches emerge as well.
Hmm. My last question is for clinicians that are entering the mental health field, particularly who want to work with people with autism or any other related conditions, what can they sort of learn to sort of be prepared to sort of dive into the field of mental health and learn how to address this population?
So what I would say is to recognize the many strengths of autism as well. It's a different way of understanding the world. And, if I wanted to find out something about a specific topic, I would definitely want to find someone that's autistic that has special interest in that area, because that is really where autism thrives. When someone that's autistic has a passion, they're going to be an absolute expert in that field. And also, yeah, recognizing that autistic people are incredibly authentic and honest. And it doesn't always just have to be that focus on what's challenging. But also imagining that or imagining the environments that that person's in and the struggles due to the environment, not just due to the individual, because I think a lot of people blame themselves, but really the world just isn't accommodating often to autism. So
Hmm.
being open-minded,
Yeah, yeah, that's important. Be open-minded and kind of, yeah,
yeah,
exactly.
and to
All right.
celebrate the strengths.
Celebrate those strengths, indeed. Yeah. All right.